For us to achieve the true promise of healthcare reform, a system of high-quality, accessible, patient-centered, and affordable healthcare for all, we now have to pay serious attention to aligning incentives. Aligned incentives means paying both hospitals and doctors for value and not volume. And it means moving from a fee-for-service, pay-for-quantity model to a model of pay-for-quality.
California employers are facing huge expenses for healthcare. I just spoke with one employer who has a 58% increase coming up next year. In every other sector of the economy, we reward value. We pay more and we create incentives for excellence, and we reward efficient use of resources through competition. We're just not doing that in healthcare. It's very important that we begin to measure costs, measure quality, measure value, and give that information to purchasers and consumers so they can make better decisions and reward the best performers in this marketplace.
To promote more efficient medical care, we should link payment to value instead of volume. But this requires valid and well-accepted measures of medical value. These measures should rely on the best available science, professional judgment, as well as patient priorities.
In determining what value in healthcare looks like, it's important to not take a one-size-fits-all approach. The diversity of California hospitals reflects the diversity of the communities we serve and the mission of the hospitals serving those communities. Some are served by a rural hospital, others by their community hospital, and in the urban areas, major public and private nonprofit teaching hospitals serve not only the entire state and beyond, but also function as the local community hospital resource for that area.
To help reduce preventable hospital readmissions, Healthcare Partners ensures that patients are cared for beyond the hospital through its eye care program. An eye care coordinator makes follow-up appointments for patients with their primary care physician at the time of discharge and ensures that a discharge summary of the hospital stay is sent directly into the patient's electronic medical record.
Healthcare-acquired infections are the fifth leading cause of death in the United States, and these infections add up to as much as $31 billion in additional, unnecessary costs to the healthcare delivery system each year. Blue Shield of California Foundation has found that in working with hospitals to promote adoption of clinical best practices in infection control and through the use of automated surveillance technologies, these strategies can be effective in reducing infections.
There are costs that can be contained with patient safety if we simply look at ways to reduce the needless costs of the practice of defensive medicine. This is not a matter of cutting the costs for the physicians, it's a matter of cutting costs for the public for doing unnecessary scans and unnecessary interventions while giving the physicians some protection from being sued for missing something very esoteric.
There's a number of activities that health plans engage in that actually add value for the patient. There are others that could benefit a lot from being streamlined. Probably the best example of this is setting common standards amongst health plans for claims, eligibility, and benefit determination, so that we can greatly simplify the administration for the physician and let them focus on what they do best, patient care.
It's critical that small businesses have an exchange that fosters competition, choice, and transparency in order to bring down the costs that are currently causing small businesses to pay 18% more for health insurance than anyone else. The exchange has got to be robust. It's got to include small businesses, large businesses, and individuals in order to be successful. And it must be able to be an active negotiator with health plans on both price and quality.
California is the only state in the nation that has two different regulators, creating confusions for both insurers and consumers. But health reform provides the opportunity, as we lift the standards up, to streamline the process by creating a single standard that has to be met across industry, whether people are in HMOs or in PPOs.
When patients and physicians together examine the science alongside patients' values and preferences, we often see reductions in hospital stays and fewer of the kinds of invasive procedures that can result in costly complications for patients.
At Hill Physicians, Value means meeting and even exceeding the expectations of our patients. Our electronic services allows patients to request online appointments, obtain their lab results, and ask any questions of their doctors online. We use our technology to trigger more frequent interactions between our nurse case managers and at-risk patients.
I think it's very important at a time when we have such a major and radical change in our healthcare system not to forget the fact that there are some social determinants and social causes of health that really impact the way our community is able to thrive or suffer from chronic illness.
A lot of illness is due to the physical or social environment in which people live. You can spend a lot of money on antihypertensives and type 2 diabetes medications, but we're trying to reduce the incidence of obesity and obesity-related costs. If we want to try to address that, then we really need to think about the environment in which people live and the opportunities they have to eat healthy food.
A major driver of higher healthcare costs is that 75% of our spending is on chronic diseases such as diabetes, high blood pressure, and heart diseases. Physical activity can prevent these diseases, but the idea of just telling people to add exercise to already busy days, it's not going to work. There is a way to accomplish this. If policymakers build our communities so that walking, biking, and using public transit is the easiest option, we will not only decrease our healthcare spending, but will improve the quality of life for millions of Americans, especially our children.